Hello guys, welcome back to my YouTube channel Knowledge is Power. Today I'll discuss a very important topic. System wise, I will discuss the drug of choice for particular disease. Firstly, I will discuss about the gastrointestinal system. The drug of choice for GERD, that is gastroesophageal reflux disease, is proton pump inhibitors. Example, argomeprazole. The drug of choice for duodenal ulcer is proton pump inhibitors. The drug of choice for stress ulcer is cimetidine. Histamine H2 receptor antagonist, drug of choice for dyspepsia, proton pump inhibitors, drug of choice for erosive esophagitis, proton pump inhibitors, drug of choice for duodenal ulcer is proton pump inhibitors, drug of choice for Zollinger-Ellison syndrome, proton pump inhibitors, drug of choice for morning sickness, prochlorperazine, that is the D2 receptor antagonist, drug of choice for NSAIDs, non-steroidal anti-inflammatory drug, uh, ulcers, proton pump inhibitors. Drug of choice for Zollinger-Ellison syndrome is proton pump inhibitors. Drug of choice for post-operative vomiting, ondansetron. Then the drug of choice for vomiting induced by cancer chemotherapy will use ondansetron. And drug of choice for radiation-induced vomiting, ondansetron. Again, drug of choice for NSAID induced gastric ulcer, we will use proton pump inhibitors. Then drug of choice for peptic ulcer, omeprazole. Drug of choice for vomiting in patients with Parkinson disease, we'll use domperidone. Or we can use selective dopamine D2 receptor antagonist. Antiemetic drug of choice is prochlorpromazine or metoclopramide. In case of pregnancy also we can use this drug. Then drug of choice for children in constipation, so castor oil we can use. Then drug of choice for cleaning bowel before delivery, we can use sodium phosphate enema. Then drug of choice for cleaning bowel for endoscopy, polyethylene glycol. Drug of choice for constipation in chronic renal failure, we can use aluminum hydroxide. The treatment of choice for functional constipation will use dietary fibers. Then the drug of choice for bedridden patient with constipation will use phenolphthalein, example of contact laxatives. Now let us continue with the gastrointestinal system again. Then drug of choice for stool softening problems, we can use dioctyl sodium sulfosuccinate. Then the drug of choice for irritable bowel syndrome, tegaserot. Drug of choice for increased motility, mozapride. Okay. Then drug of choice for diabetic gastroparesis is mozapride. Then drug of choice for spasmodic abdominal pain, we can use phosphodiesterase inhibitors group of drugs. Then drug of choice for pain relief in ulcer, antacids is the preferable one. Then drug of choice for diabetic diarrhea, clonidine, that is an example of alpha 2 adrenergic agonist. Drug of choice for non-infectious diarrhea, loperamide. Drug of choice for secretory diarrhea, cholecysteramine. Drug of choice for carcinoid syndrome, cyprohepatidine. Then drug of choice for inducing vomiting, apomorphine. We can give this drug through the parenteral routes. Then drug of choice shortening gastric emptying time before surgery, that is metoclopramide, that is an antiemetic drug. Then drug of choice for Mendelian syndrome is also metoclopramide. Then drug of choice for vomiting in children, metoclopramide. And drug of choice for inducing vomiting, we can use ipicacuanha. Then drug of choice for laxative effect in patients with hepatic encephalopathy is lactulose. Now let us continue with the drug of choices with the respiratory system. First is the drug of choice for COPD is anticholinergic group of drugs, example tiotropium. The first line of drugs that is used for tuberculosis are rifampicin, isoniazid, pyrazinamide, ethambutol and streptomycin. The drug of choice for testing bronchial hyperactivity, methacholine. Drug of choice for pulmonary edema with congestive heart failure, furosemide. Drug of choice for vasodilatory shock, norepinephrine. Drug of choice for persistent hiccups, carbon dioxide. Drug of choice for apnea in premature infant, theophylline. Drug of choice for exercise-induced asthma, mast cell stabilizer. Example, sodium chromoglycate. sodium chromoglycate. Okay. Then drug of choice for aspirin induced asthma, leukotriene antagonist, example montelukast. Drug of choice for starting treatment of asthma, inhale beta 2 agonist, example salmeterol. Then drug of choice for bronchospasm with COPD, ipratropium bromide. Drug of choice for smoking, nicotine. Drug of choice for liquefying plaques of sputum in patients with cystic fibrosis is acetylcysteine. Drug of choice for temporal arteritis, corticosteroids group of drugs we can use. Then drug of choice for prophylaxis of exercise induced asthma, sodium chromoglycate. Then drug of choice for pulmonary edema is furosemide. Drug of choice for dry itchy cough, codeine. Drug of choice for acute asthmatic, we can use salbutamol syrups, short-acting selective beta-2 adrenergic receptor agonist. Then drug of choice for persistent asthma, we will use inhaled corticosteroids. Drug of choice for an asthmatic patient with hypertension, the drug is amlodipine. Then drug of choice for pneumocystitis carinii, that is cotrimoxazole, we can use. Drug of choice for suppression of cough, dextromethorphan. Drug of choice for AC inhibitor induced cough, aspirin. Drug of choice for asthma in diabetes, ipratropium. And drug of choice for beta blockers induced bronchospasm, ipratropium bromide. Drug of choice for mild intermittent, inhale beta 2 agonist. Drug of choice for mild persistent, inhale low dose corticosteroid, or we can use mast cell stabilizers or leukotrienes antagonists. Drug of choice for moderate persistent asthma, inhale corticosteroid with long acting beta 2 agonist. Drug of choice for severe persistent asthma, high dose inhale corticosteroid with long acting beta 2 agonist and oral corticosteroids. Drug of choice for poorly controlled asthma, theophylline. Drug of choice for prophylaxis of asthma, sodium chromoglycate, it is mast cell stabilizer. Now let us discuss with the another system, that is cardiovascular system drugs. First is the drug of choice for torsade de pointes, magnesium sulfate. Drug of choice for dyslipidemia, HMG CoA reductase inhibitors. Then drug of choice for hypertriglyceridemia, fibric acid. Drug of choice for myocardial infarction pain, morphine. Drug of choice for mild hypertension, diuretics. Drug of choice for hypertensive crisis, nitroprusides. Drug of choice for hypertension with BPH, benign prostate hypertrophy, will use prazosin. Drug of choice for hypertension with ischemic heart disease, beta blockers. Drug of choice for hypertension with ischemic heart disease, will use beta blockers. Drug of choice for hypertension with diabetes mellitus, AC inhibitors. Drug of choice for hypertension with diabetic nephropathy, AC inhibitors. Drug of choice for hypertension in young patient, AC inhibitors, example captopril, lanopril. Okay. Drug of choice for unilateral artery stenosis, AC inhibitors. Drug of choice for hypertension with renal disease, AC inhibitors. Drug of choice for hypertension in congestive heart failure, AC inhibitors. Drug of choice for hypertension in non-diabetic proteinuria, AC inhibitors. Drug of choice for hypertension in asthma, AC inhibitors. Drug of choice for hypertension in patients with ischemic heart disease, beta blockers. Drug of choice for isolated systolic hypertension, calcium channel blockers. Also we can use low renin hypertension cases, also we can use calcium channel blockers. Then drug of choice for hypertension with bronchial asthma will use AC inhibitors or calcium channel blockers. Again, the cases with hypertension along with CKD will use AC inhibitors. Then the drug of choice for hypertension preferred cases in older patients, thiazides group of drugs will use. Again, if a person will suffer from digoxin overdose, we can use digiban or digifab. Then drug of choice for group B streptococcal infection, ampicillin. Drug of choice for endocarditis, amoxicillin. Then the drug of choice for digoxin toxicity is potassium. First line drug of choice for CHF is AC inhibitors. Then drug of choice for rapid fast diuresis, loop diuretics, example furosemide. Drug of choice for multi-local atrial tachycardia, verapamil is an example of calcium channel blocker. Then drug of choice for paroxysmal supraventricular tachycardia, also known as PSVT, we can use adenosine, is an antiarrhythmic agent. Then drug of choice for supraventricular tachycardia is verapamil. Then drug of choice for digitalis induced ventricular arrhythmia, lignocaine. Then drug of choice for ventricular arrhythmia, lidocaine. Drug of choice for ventricular tachycardia and fibrillation, lidocaine. Then drug of choice for atrial fibrillation, digitalis. Drug of choice for maintaining sinus rhythm, amiodarone is an antiarrhythmic agent. Then drug of choice for Wolff Parkinson White syndrome, you will use prokinamide or amiodarone. Drug of choice for digitalis induced arrhythmia, lignocaine. Drug of choice for acute left ventricular failure, IV furosemide. Drug of choice for scleroderma induced hypertensive crisis, AC inhibitors. Drug of choice for acute long QT syndrome, magnesium sulfate. Drug of choice for congenital long QT syndrome, beta blockers. Drug of choice for hypertension, peripheral vascular disease, calcium channel blockers. Drug of choice for hypertensive emergency, sodium nitroprusside is an example of vasodilators. Drug of choice for malignant hypertension, nitroprussides. Then drug of choice for producing control hypotension, sodium nitroprussides. Drug of choice for pulmonary hypertension, bosentan. Drug of choice for atrial flutter and fibrillation, ubitilide. Drug of choice for paradoxical tachycardia, digoxin. Drug of choice for angina nitrates. Drug of choice for prophylaxis of stable angina, beta blockers. Drug of choice for variant angina, calcium channel blockers. Example, verapamil. Drug of choice for diabetic dyslipidemia, statins. Example, atorvastatin and rosuvastatin. Then the drug of choices for this beta-lipoproteinemia, fibrates. Drug of choice for severe hypercholesterolemia, nicotinic acid. Drug of choice for severe hypercholesterolemia will use rosuvastatin. Drug of choice for lowering TAG levels, fibrates. Drug of choice for lowering LDL cholesterol level will use HMG coenzyme A reductase inhibitors. Drug of choice for cardiogenic shock with renal failure, dopamine. Drug of choice for rheumatic fever, benzathine, penicillin. Drug of choice for increasing HDL cholesterol, niacin. Drug of choice for pulmonary edema with congestive heart failure, furosemide is an example of loop diuretics. Then the drug of choice for rheumatic fever, benzathine, penicillin. Then the drug of choice for tetralogy of Fallot will use morphine. The drug of choice for reducing mortality in congestive heart failure, spironolactone. Then drug of choice for inotropic effect, dobutamine. Drug of choice for a hypertensive patient with benign prostatic hyperplasia, BPH, alpha 1 blockers, example prozazine, terazosin, doxazosin, alfuzosin. Drug of choice for perioperative arrhythmia, esmolol, is an example of cardioselective beta blockers. Next system is central nervous system. There is a list of drugs for particular disease. Then the next system I will be discussing in my next video is the drug of choice in pregnancy. So it is a very important video. You need to watch. Okay, you need to know all the drug of choice. Then only you will be confident enough. Then also the renal system, the drug of choices I will be discussing in my next video. Then endocrine system I will be discussing in my next video. Then the hematology system also I will discuss. Then ophthalmology, dermatology, antimicrobial drugs I will discuss in my upcoming video. So till then, don't forget to click the bell icon below, and if you are new to this channel, don't forget to show your valuable feedback also. I will be discussing also the drug of choice for poisoning. Okay, then I will discuss about the anti-cancer drugs. Okay, this is the entire list I will be discussing in my upcoming video part by part. I don't want to exceed my duration in this video, so I will further continue with my upcoming video. So if you find this video useful, please share among your friends who are preparing for viva exams, nursing exams, okay, even preparing for norcet. Even if you are CHO, you need to know all the drug of choices. Okay, so thank you and keep supporting.